So to introduce Ben, Ben has done an awesome job trying to link orthopedics and spaceflight, which seemingly may not have anything to do with each other, but we're going to learn about it. And so I want you guys to welcome Ben, one of our lovely PGY2s, soon to be threes. Thank you, Ben.
All right, thank you. All right, well, thank you for giving me a platform to talk about probably one of the most niche grand round topics. Anyone who's been around me for more than 5 minutes knows that I certainly like to talk, and this comes up pretty quickly in most of my conversations. All right, so just to outline what we're going to go through here, kind of try to work my way through the musculoskeletal system, starting with bone mineral density, then fracture, soft tissue, muscle, tendon, and thesis. A little bit about cartilage and spine, but those are so significantly less amount known about those. So why does this matter? It probably doesn't right now, but I foresee it mattering in the future. There's the private expansion of spaceflight occurring at a very rapid rate. All these companies have become relatively household names, I feel like, in the past few years. You got SpaceX, Axiom, Blue Origin, Virgin Galactic. Katy Perry went to space. Everyone knows about that. On top of that, NASA, as well as some of these private space agencies, are pushing the boundaries of spaceflight to kind of depths we've never been before. There's aspirations for longer distance, longer duration missions, going to the moon, going to Mars. These are space flights that take 3 years, and no human being has been in space for that long. So how does that affect the human body and musculoskeletal system? There's also the newfound militarization of space. The United States now has an official space force as part of their Air Force. And while it's mostly weapons-based right now and navigation-based, there's possibility for having fighters out in space at some point. And then also, I think most important to this talk, there are some principles of spaceflight related orthopedic changes in health that we can kind of use to consider how we treat our patients here on Earth. So this is Suni Williams. This is that astronaut that was supposed to go up to space for a couple of weeks and ended up getting stuck there for 286 days. And you can really see the toll that the space flight atmosphere took on her with regards to kind of rapidly enhancing her physiologic aging. And the only comparison that I could think of that rapidly enhances our aging like that is residency. And if you don't believe me, this is Bill before starting residency. And this is Bill exactly 286 days later. So the work speaks for itself. All right, so getting into bone mineral density to start. So this is probably the most well-studied aspect of how spaceflight affects the musculoskeletal system. We know that astronauts who have gone up to space for anywhere from 4 to 6 months experience pretty substantial and precipitous declines in their bone mineral density. It goes about 1% decrease per month on average in space. And notably, this decrease tends to occur at a pretty linear rate. So there's some theories that will eventually plateau around 69 to 70% of your starting bone mineral density, but no one's been in space that long. And as far as we can tell, every month you lose about 1% of your bone mineral density. And based on DEXA scans and reports we have of astronauts, no surprise, it's mostly confined to the weight-bearing regions of the axial skeleton. I don't really know why this is the case, but it actually does seem to be more affecting men than women in spaceflight. And that kind of leads credence to maybe some theories that maybe there's something going on beyond just microgravity itself that's kind of contributing to this. But getting into the whys of why astronauts lose their bone mineral density in space, the biggest thing is microgravity. So human beings have evolved to live on Earth in a gravitational environment. Our bones are in homeostasis between osteoclast and osteoclast as a result of that gravitational stimulus. If you remove that stimulus, you lose the maintenance of that homeostasis. Osteoblasts and osteoclasts kind of establish a new homeostasis that leads to weaker, more brittle bones with decreased bone mineral density. We also know that there's pretty high levels of radiation in space that are likely contributing. And then there's some newer theories coming to light as to what may be contributing to this, such as elevated carbon dioxide. So they have all these machines essentially to try to wash carbon dioxide and recreate Earth's atmosphere in the spaceflight environment. But no matter what they do, there's elevated levels of carbon dioxide relative to Earth. And if everyone remembers their step one, if you have elevated carbon dioxide, you have respiratory acidosis, and your body tries to compensate for that respiratory acidosis by pulling buffers from other systems. And in this case, it would be resorption of calcium from bone, also kind of contributing to that more resorptive state. And then something interesting, and I'm kind of going to go back and forth with this because it comes up quite a bit, is vestibular dysfunction. So Dr. Terrestrial, actually out of Baylor, published his paper a few years ago, And it showed that if you knock out the vestibular system in mice, they experience the exact same pattern of bone mineral density loss as rats that were sent to space. Same areas of the body, same degree of bone mineral density loss. So this is obviously a big problem for NASA, and it's something that they've attempted to prevent and track. And the main modality of prevention is they've developed this advanced resistive exercise device, the ARED, and you can see pictures of that here on the right. Basically, what it uses is a series of flywheels to generate inertia, because you can't really simulate gravity otherwise, and it allows them to astronauts to perform resistance training in space. The current protocols have astronauts performing about 2.5 hours of resistance training 6 times a week on their space flights. We also have started to use bisphosphonates to try to maintain bone mineral density and health. And then there's kind of more simple things, looking at nutrition, calcium and vitamin D, making sure that they're adequately supplemented in these astronauts' diet. What's interesting, though, is that no matter what you do, no matter what combination of these you implement, you can't really completely prevent the bone mineral density loss. You can mitigate the degree of loss, but there's still pretty substantial declines in bone density. Now, the question is, does this recover? Does this affect astronauts when they get back to Earth in a complete partial or a complete gravity environment, or if we're considering missions to Mars or the Moon, in partial gravity environments as well? And bone resorption biomarkers go back to pre-flight levels almost immediately upon return to Earth. So you stop kind of resorbing as much, but bone formation biomarkers to compensate for that bone loss don't really go back to normal until about 3 to 5 months. If you actually look at the microarchitecture of bone, they've looked at cross-sectional area of the tibia and everything, you'll see that there's some persistent changes that don't really ever return back to normal. So this is some data from papers that we've done here. And this tracks the T-scores of astronauts before spaceflight, immediately after spaceflight, and up to a year out. So we were able to use, I believe, 96 astronauts and track their changes in bone mineral density. And you can see here, there's pretty substantial decline in the bone mineral density from pre-flight to immediately post-flight. And that is really at a linear rate. And then you can see on the return, it goes back at kind of a logarithmic rate and starts to plateau as time goes on, often leading to incomplete recovery. Something notable here is that if you actually look at the forearm, that top line, it goes up with in spaceflight. And I kind of think that this lends credence to the role that microgravity really plays and the role of loading our bones on Earth, because on Earth, we are all bipedal ambulators. We walk on our feet and we don't walk on our hands. On a spaceship, you essentially have to utilize propulsion-based mobility, and you're more using your hands and loading your arms to get around, which probably leads to this increased bone mineral density of the arms. What's especially interesting is if you kind of break this down and you look at how bone mineral density is affected by time in spaceflight, what you'll find is that astronauts that spend more time in spaceflight have more significant drops in their bone mineral density. That's something we've discussed, but they also have less complete recovery of their bone mineral density, especially if you look at the hip and the femur. It's pretty well below the recovery for patients with 6 months of time in spaceflight compared to those who spent less time in spaceflight. And this kind of just leads me to believe that there's probably some degree of bone mineral density loss that you will achieve based on time in spaceflight that is just never going to be completely recoverable. So how is that really kind of affecting how we view things here on Earth? Multiple studies have demonstrated that there's an association between vestibular dysfunction and decreased bone mineral density. Patients with vestibular dysfunction on Earth tend to have pronounced loss of bone mineral density in their weight-bearing portions of their axial skeleton compared to people who do not have vestibular dysfunction. And this, similar to the rat study, follows a very similar pattern to the bone mineral density loss in astronauts. If you actually ask a bunch of these NASA scientists why this is happening, they won't be able to give you a real reason. No one really knows. It's kind of what comes first and what causes the other. Does the vestibular dysfunction lead to people on Earth not really wanting to walk as much, not weight bearing as much? And does that cause the bone mineral density loss? Is there bone resorption issues that increase calcium in your blood, basically, which leads to the vestibular dysfunction? Or is it vice versa? Is it the vestibular dysfunction that leads to the bone density loss? We don't know. But if you go back to the rat study again, what they found is that if you give beta blockers to these rats, specifically propranolol, the rats in space and the rats with vestibular dysfunction experience no bone mineral density loss. So there's some form of the sympathetic nervous system that's contributing to this resorption. Beta blockers are also associated with higher bone mineral density in terrestrial studies as well, so here on Earth. So this is kind of giving me some perspective things to consider when we treat our patients here. We see a good amount of patients that suffer fragility fractures, and we're pretty good getting better at referring patients appropriately to the endocrinologist to work up their cause of their osteoporosis. But I'm as guilty as anyone. I don't think I've ever asked a single patient that sustained a fall that I'm treating acutely for a hip fracture if they have BPV or Meniere's disease or anything that kind of affects their ability to ambulate or any sort of their CNS system. And if you look here, there's good data that shows that there's very strong associations with BPV specifically and the development of osteoporosis and osteopenia. So maybe it's something that we can consider, also working up, when we're sending patients to the endocrinologist, maybe it's worth asking patients if they also have issues with vestibular dysfunction, dizziness, vertigo, things of that nature. All right, getting into fracture. I thought Brent, you looked very handsome here, so you get a little nod. All right, so we know that decreased bone mineral density increases your risk for fracture on Earth. That's the whole premise of kind of the FRAX score is, it takes a bunch of patient-related demographic factors and variables, but also it takes patients' bone mineral density at their femoral neck to predict their risk of future fracture. While we know bone mineral density is significantly affected in space, the risk of fracture in space is actually very low. And that's because when people fracture bones on Earth, it's usually associated with applied loads of falling or other mechanisms of trauma. And that basically doesn't exist in space. In the microgravity environment, there's no applied loads with falling. So these models kind of look at when the risk of fracture is greatest, and they find that it's during these extravehicular activities. And it's mostly just because you're doing a bunch of weird stuff that human beings weren't meant to do in weird body positions. And there's no reported intraflight fractures to date. The real risk comes when you return to a gravitational environment. And like I mentioned previously, that used to be just on Earth, but now what happens if you get to Mars, which is 1/3 Earth's gravity, or the moon, which is 1/6 Earth's gravity, and you have applied loads with falling again, to a lesser degree, but still applied loads? What happens to the fracture risk, and what happens if we fracture there? They've got all these models. None of it's all theoretical at this point, but they use data from the Apollo moon missions and what we plan to do on Mars. And they basically find that there is a pretty substantial risk of fracture in these partial gravity environments, especially in the distal radius. So if you look at the data, this is some stuff that we've also done here. There is reported incidence of post-space flight fracture in the short-term period. So we looked at 242 astronauts, and we found that 7 fractures occurred within 5 years of return from spaceflight. 3 of those fractures were in the hip or spine. And so due to data sharing issues and everything, I don't really have that much information on the demographic factors of the patients that experience these fractures, and I don't know the mechanism of these fractures. But the average age of an astronaut, in this study was 48 years old. They're otherwise the healthiest people in the world. I just find it atypical that they're experiencing hip and spine fractures regardless. And then what does it mean if we, sustain a fracture in these remote environments? So there's no x-rays in space. There's just ultrasound. The ability to diagnose fracture with ultrasound is relatively equivocal. And then what do we do if you do, actually fracture a bone? This is currently what is in NASA's first aid kit in their musculoskeletal section. It's 3 ACE bandages, 1 finger splint, and 1 leg/arm splint, whatever that means. So I think that the associations, the morbidity and mortality associations that would be kind of implicated here are pretty significant. It's if you break your hip on Mars, I don't think that you're in good shape. You got a 6-month space flight home. There's probably only 3 other people that don't know how to treat hips. Until we can get, one of us up there to put a cephalomedular nail in, I think we're in trouble. And you'll also see that these risks propagate throughout a lifetime. So this data looked at 262 astronauts, all men actually, that spent what they considered long duration time in space, which was greater than 3 months, or short duration in space, which is less than 3 months. And they found a relative risk of about 3.4 times risk of lifetime hip fracture and 3.4 times lifetime risk of spine fracture in astronauts that spent greater than 3 months in space compared to less than 3 months in space. And that's not even compared to controls. To make matters worse, fracture does not heal well in space at all. Bone regeneration produces smaller callus. There's less fully bridged fracture gaps. Bone strength is significantly worse. There's decreased recruitment of red blood cells and T cells. And there's lower transcription factors for osteogenesis, chondrogenesis, angiogenesis, you name it. So, kind of tying this all back to what it makes me think about with our patients here on Earth. If you look at this femoral neck T-score again, you see that the longer time you spent non-weight bearing, the less complete your bone mineral density recovery is. Does the same principle apply to non-weight bearing patients on Earth? So bed rest studies will say yes. If you put someone in bed for long enough, they will experience a degree of bone mineral density recovery that is, bone mineral density loss that is not recoverable. So we often will non-weight bear patients after they sustain fractures, periarticular fractures, pilons, plateaus, whatnot. And is there an amount of time where that disuse osteopenia becomes permanent and leads to an increased risk of fragility fracture on the ipsilateral side? It's basically an impossible study to do, but it's an interesting, thing to consider when you're trying to weigh whether or not to weight bear patients versus non-weight bear patients. And obviously it's related to healing as well. All right, soft tissue. So yeah, I thought this was an excellent example of what I imagine the atrophy in spaceflight to be like. All right, so muscle. So this is the big one. There's significant atrophy in spaceflight. When you unload muscle, you have reduced synthesis, increased protein degradation, decreased muscle mass. We see this on Earth all the time. If you take some time off the gym, you get smaller. In spaceflight, it specifically is a decrease in size, not number of muscle fibers, and it's class 1 preferentially over class 2 loss. After about a week in spaceflight, astronauts have been noted to lose up to 20% of their calf muscle mass. After 3 to 6 months, it goes up to about 30%. There's some theories that it probably plateaus around 40%. Again, no one's been in space long enough to really know that definitively. It's all theoretical. Tendons also affected. So when you unload tendon, you have increased or reduced fibroblast activation, collagen synthesis, and transcription factors. This doesn't decrease the size of tendon, but it reduces the stiffness of tendon. And this is found, on Earth as well. When you put patients in bed rest for an extended period of time, they'll have decreased stiffness of their tendon by up to 60%. Even if they exercise while on bed rest, there's still about 40% decline in the stiffness of their tendon. The enthesis, where the tendon inserts into bone, also gets pretty lax in this environment. So the reason why this is especially relevant is as you have a combination of muscle atrophy and tendon enthesis laxity, your ability to contract through the entire muscle tendon enthesis unit decreases, and it decreases to a degree that is greater than the individual laxity or atrophy associated with each of those components of the unit. Prevention is kind of the same as with the other two. They really rely on the advanced resistive exercise device to try to simulate weight bearing and mitigate strength loss. There's been some theories about using different hormones and optimizing nutrition, especially protein, but again, doesn't seem to really be all that helpful in the grand scheme of things. Unlike bone, though, it does seem like muscle mass and strength is recoverable upon return to gravitational environment, but it can take up to 1 to 4 years to get back to that pre-flight level. And I think this is important because I think sarcopenia is kind of maybe under appreciated with its relevance in maintaining the musculoskeletal health of our patients. There's a 1.4 times hazard ratio for hip fracture in sarcopenic patients. So I obviously have to wedge in, one shoulder slide here. Shoulder issues in astronauts are really prevalent. Even in the pre-flight period, the training related to going to space puts the shoulder under significant tension and increases risk of injury. In pre-flight training, about 10% of astronauts experience a pretty debilitating shoulder injury, so much so that in 2003, NASA implemented this whole Tiger team to go in and try to determine what is likely causing all of these injuries. What they really found is that the spacesuit is not all that well designed for shoulder motion. It leads to increased impingement and a bunch of issues. You're also using upper extremity-based propulsion, which human bodies aren't designed to do. You're in weird body positions. You're doing repetitive motions and overhead tasks. These injuries seem to propagate in the post-flight period. So we did this paper here, and we found that astronauts that spend greater than 6 months in spaceflight are significantly more likely to experience rotator cuff tears, impingement, and other shoulder injuries compared to astronauts that spend less than 6 months. If you actually look at the data, it's pretty profound. There were more rotator cuff tears among the 20 astronauts that spent greater than 6 months in spaceflight compared to the 200 astronauts that spent less than 6 months in spaceflight. We don't really know why, and there are MRIs that you can get access to through a series of grants and whatnot, but it's quite challenging to look at what actually happens to the rotator cuff. So this is largely theoretical, but my kind of take on this is that it's probably still related mostly to the spacesuit itself. Longer duration space flights is associated with more time in the spacesuit, more inverted body positioning, all the things the Tiger team basically found, which also probably contributes to the degradation of the cuff. So how have I used this information to kind of alter my perspective here? We already know astronauts are at increased risk for fragility fracture. I showed you that in the slide a couple back, which showed 3.4 times risk of hip and spine fractures. And I think that oftentimes this gets largely attributed exclusively to the bone mineral density changes that occur. But there's pretty substantial sarcopenia that occurs, and a lot of fractures occur within the first 5 years back from spaceflight. If it takes 4 years for your muscles to recover, it's quite possible sarcopenia is contributing to those fractures. If you look here on this data to the right, there's excellent data across pretty much all fields of medicine that sarcopenia is associated with worse outcomes following pretty much any medical issue, MI, stroke, cancer, and for us, falls and fracture. The lowest third grip strength does worse, and grip strength is just a proxy for overall strength. It's easy to measure here in terms of outcomes after all of these. So again, we're good at sending patients to the endocrinologist to get worked up and put on bisphosphonates and whatnot. But could we be better about making sure that all of our patients are getting adequate therapy and maximizing their strength to improve their outcomes with recovery? All right, cartilage. This section, this is the most lacking in terms of information, but hopefully we'll have some more stuff soon. They just sent a couple of astronauts to space on an Axiom mission, and they're measuring their cartilage via ultrasound. Hopefully we'll have that data soon to see if it yields anything. But we know that articular cartilage, like every other system I've discussed so far, is sensitive to mechanical loading. Obviously axial loading, but also more complex loading and shear forces. So as you lose that load-bearing stimulus, you end up having decreased sulfation of those glycosaminoglycan contents, which leads to a thinner, more atrophied version of cartilage, especially in the knee. And we know that this CTX2 marker is a pretty good predictor of severity of arthritis, need for future arthroplasty. And what they find in both animal models and human models is that there's increased CTX2 biomarkers for cartilage degradation in the spaceflight period. And this rise occurs pretty rapidly. So in terms of prevention, the ARED, obviously, what I think is funny is that they're so desperate for preservation of cartilage that they started utilizing this vibration training, which there's very little data to support it being helpful at all. But NASA has tried to implement it on some of their missions to improve cartilage health. In terms of recovery, so does that atrophied thinner version of cartilage come back to normal upon return from spaceflight? We really only have animal models to know. So the answer is yes, kind of. This study here took 30 mice basically, or 2 groups of 30 mice, and it put them both hind limb unloading. So took their back legs, put them off the ground for 30 days. And then one group, they let exercise again after 30 days, and they had them running on the wheel and climbing and whatnot. And the other group, they had do absolutely nothing. And what they found is that the cartilage only returned to normal in the mice that were exercising. In the mice that did not exercise, there was no restoration of cartilage. In the human model, when you look at just this biomarker, because like I said, no one's really looked at the cartilage itself, you find that only half of astronauts recovered to their pre-flight levels of CTX2, that marker of cartilage degradation, within 1 year return from spaceflight. So again, this is largely theoretical, but if you look at this paper from JAMA, I think it helps explain maybe why some of the cartilage isn't returning. We know weight-bearing activities are technically a risk factor for radiographic and clinical development of arthritis, but it's really only in patients who are in the lowest third of lean mass index. So the weakest, most sarcopenic patients are the only ones who really have the risk of development of arthritis with weight-bearing activity. And this makes sense in the context of astronauts. They come back incredibly sarcopenic. They have 30 to 40% losses in their strength of their lower extremities. Maybe that's contributing to a future arthritic phenotype. I haven't heard specifically of any actual incidents of astronauts getting joint replacement, but anecdotally, I've heard some people say that there's 5 or 6 astronauts in the past couple of years that have gone up and developed pretty rapid onset arthritis after coming back from the space station, especially after longer trips. So getting into the terrestrial implications of this all, we know sarcopenia is associated with hip and knee arthritis. It's been cited in multiple publications. We also know frailty is associated with worse outcomes after total joints. And we know that osteoporosis, increases risk for periprosthetic fracture and possibly, all cause revision. The data on this is relatively equivocal, but maybe there's a role for some form of rehabilitation or frailty optimization in these elective joints. And maybe there's some sort of strength proxy that we can use related to grip strength or some other metric that can, screen patients for if they're appropriate for elective total joints. We do the same thing with diabetes. We do it with smoking status. We do it with their dental hygiene, but maybe there's a role for looking at their sarcopenia as well. And if all else fails, I'm going to start referring patients to Eric's vibration training clinic. He just goes to Austin's backyard and asks them to turn it up to maximum vibration. It's very off-putting. And lastly, we'll talk about spine here. So, the spine undergoes some pretty substantial change in the spaceflight environment as well. It elongates by 4 to 6 centimeters almost immediately upon entry to the spaceflight atmosphere. And it's associated with flattening of lumbar lordosis, cervical lordosis, as well as kyphosis of the thoracic spine. You have hyperhydration of the intervertebral disc, you have bone mineral density loss, and paraspinal muscle atrophy. Back pain is really common among astronauts. About 50% of astronauts experience back pain upon exposure to spaceflight. You get put in a spaceship and it accelerates at velocities that no human being was ever meant to go, and then it decelerates at similar velocities. It's no surprise that it can be uncomfortable on one's back. It's so common that there's something called space adaptation back pain, which is just this acute, self-limited, transient back pain. What's interesting is that MRIs of astronauts that have gone to space find that this flattening of lumbar curvature specifically persists actually upon return to Earth. And it's associated with a very increased lifetime risk of cervical and lumbar disc herniation following spaceflight compared to control. So those that haven't participated in spaceflight. And this risk is especially pronounced in the first year upon return. There's a 36 times risk of cervical disc herniation compared to controls when they return to a gravitational environment. My only theory as to why the cervical disc herniation rate is so much higher than even the lumbar disc herniation rate is that we are decent at simulating weight bearing below the shoulders. If you look at how they use the advanced resistive exercise device, it puts a barbell on your shoulder essentially, and it's not necessarily loading your neck. So I don't think that there's a good way to fully simulate gravity in the neck, at least in spaceflight right now. And like I said, the risk of herniation is most pronounced upon return to gravitational environment. So so far this has just been patients get disc herniations when they return to Earth and we treat them. But what happens if you, have a cervical disc herniation on Mars or the moon? If my experience in spine clinic is even remotely accurate, it sounds like it would be absolutely horrible. We don't really have an answer. Right now, NASA's prevention model is to use this thing called the penguin suit, which uses a series of pulleys and straps to try to simulate weight bearing. It looks awful. And they also recommend sleeping in the fetal position. And so I think that we should start recommending Dr. Kong's patients to put on penguin suits and just curl up into a ball. And then also this is like, no bending, lifting, twisting. I've heard that a million times. Not to beat a dead horse, it's the same concept as with cartilage and with the overall musculoskeletal health of patients. There's worse pre-op function, worse pre-op pain, worse post-operative outcomes after spine surgery in patients that are frail, sarcopenic, and osteoporotic. Can we be considering ways to better optimize patients, for elective surgery, especially, or even non-operative management? Can we be optimizing their strength, their bone strength, their vestibular dysfunction, things of that nature, prior to kind of proceeding with, any sort of operative intervention? So in summary, I think I've covered most of the systems. Spaceflight impacts all aspects of the musculoskeletal system. You have the rapid physiologic aging of the most otherwise healthy individuals in the world. They undergo all this fitness testing and lab testing and physicals, and they have to pass 1 million exams before they go to space, and they still age at this relatively rapid rate. And that physiologic aging, the sarcopenia, the osteoporosis, all of that is associated with increased risk of injury that they may or may not have otherwise experienced, but they certainly seem to experience it at an increased rate, or at least sooner. And I think that there's a lot to be taken away from what we know about how astronauts, their musculoskeletal health is affected and how we treat our patients. Like I mentioned in the last slide, can we be better optimizing patients' sarcopenia, their osteoporosis? Can we be asking about vestibular dysfunction? Things like that to try to give our patients the best outcomes. That's all I got.